It was really,
I don't know
really
about
interesting.
that. Well, if you think about it though, if you
It's
think
new,
about what
I
asthma
think it's a
is.
singular study, so I think they're gonna have to keep going back and seeing, is this...
Well, here's what I see. Number one, there are a ton of people out there that aren't treated, that have COPD, that have asthma, that are not treated, okay? And they're having flares. If you look at the gold standards of treatment for asthma and for COPD, they're very specific about if you have 2 acute episodes, how often you use a rescue inhaler.
Right.
And if people don't go in and see their doctor and say, hey, I'm having this, and if their doctor isn't on it and putting them on maintenance medications because they're underdiagnosed and undertreated,
Right.
you're going to end up with more problems. I mean, it's very helpful. My guess is that if you are aggressive about treatment initially and prevent this chronic inflammation, the fact may be that with time, their body doesn't respond the same way, and they probably could get weaned off of things and just use a rescue inhaler. That's my hypothesis of what you're talking about.
Right.
So,
Yeah.
I mean, that's my guess.
She was hospitalized when she was younger, now she's 19, and she only has a rescue inhaler, and she might use it once a year.
And I will tell you, kids that develop asthma young, if they're not in a house with noxious stimuli, they often will outgrow their asthma with age. Their body compensates.
Yeah.
So it's not unusual to see someone who has juvenile asthma that might outgrow with age, as long as they're not exposed to a lot of irritants. That's more common with kids, that they will outgrow.
I outgrow my asthma.
Yeah.
I had asthma when I was 11, 12,
Yep.
13,
Yep.
14.
And you outgrow.
I haven't had asthma I've
Yep.
never had an attack. I don't even have an inhaler anymore.
Yeah, because you don't need it.
I don't.
Yeah, so she's a perfect example. And then you do see that in youngsters. They often will outgrow their asthma.
So, what do you think about a kid that had, like, since October, 4 times bronchiolitis?
How old?
6, 7.
Little.
It's like my daughter.
Yeah.
She's very healthy. She never had a cold when she was younger. But since October, she has 4 times that she lows pulse ox and difficult to breathe.
Did she have any upper respiratory infections that triggered anything?
Cold, maybe, like.
So she's pretty reactive airway disease. Have they done any PFTs or anything on it?
No, nothing.
So, I mean,
Just prescribed the inhaler for that time and prednisone.
And how long does she go in between cases that she ends up?
It was like September, then October, then December, and then February.
So she goes like 2 weeks without being on steroids and goes back into bronchiolitis?
No. She stayed like, she got the prednisone, like 2nd, 3rd day that of prednisone, she was like
Symptoms went away.
100%.
So how long after the taper is stopped that she reoccur though?
About 3 weeks, 4 weeks, maybe more.
Yeah. So, you know, with somebody like that, you need to do PFTs on them.
PFT.
Yeah, to figure out what's going on with her. Does she have some underlying asthma and restrictive disease? She's had enough episodes that I would wonder about whether she has some underlying asthma. And she's young. So again, it could be something that she'll outgrow, and it may just be developmental, and as she gets older, she'll have more surfactant and everything will get better, but I certainly, that's significant. Yeah, it's significant. She should probably have PFTs.
Okay,
I would think, if it was my kid, I'd be saying, listen, I want some PFTs, I want her to see some
sounds great, yeah.
Just, and it may be, like I said to you, my guess is that she'll probably outgrow it, but she can't be constantly on steroids, that's not good for you.
Right,
Yeah, it's
yes, I
not
don't
good.
like that idea, that's
Yeah, it
why
makes me
I'm
nervous.
like.
Steroids are great things in the right place at the right time.
Right.
You know, so they're a double-edged sword. So the problem with inhaled drugs is obviously when you get inhaled steroids, it masks inflammation, so it can mask underlying problems. Because if somebody's using their inhaler too much, their rescue inhaler, and they're not getting treated, they're not getting put on maintenance medications. If you're not getting put on maintenance medication, you have more damage, and so it actually can make things worse. So you have to be really clear with patients. And you know what? This all takes time and reinforcement. And if a patient doesn't come back to see you, it's very difficult to do that. So it has to, you have to have good communication between your primary care physician and the patients and have good follow-up. And these are just guidelines. that there's 4 different degrees of severity for asthma? 2008. That was like 9 years ago. All right, so why doesn't everybody go to the bathroom, stretch your legs, get a drink of water, turn off the camera, and then we'll do half of the next lecture.